is functional movement disorder is the subject of this video. I've done a video on what it is, and now let's find out what causes it. Stay tuned. Hey, I'm Dr. Shaki from Irvine Spinal Wellness Center, your Irvine Posture, Movement, and Chiropractic Clinic. I've done a video on functional movement disorder, which we're going to make sure is at the end of this video so you can watch. But the important thing now is what causes it to begin with. And a lot of times people get lost there because they're thinking, well, I didn't have any accidents. I never played sports really. I've never had an injury. Why is it that I'm dysfunctional in my movement? First of all, injuries are not necessarily an incident that happened that caused the injury. Let's say you're playing volleyball and you dislocate your shoulder. That's an accident or an injury. But you need to understand injuries can be over time in incremental, small increments. So repetitive stress injuries are that category. So the repetitive stress injuries doesn't mean that you're working at a grocery store and moving things on a conveyor belt, for example. If you're typing away over and over, that's a repetitive stress injury. That typing away, the lifestyle at your work, the accidents you've had, the overall injuries you've had, the sports you played as a child, the classes you took growing up in gymnastics. This is the posture of choice that's encouraged. In ballet, that's what it is. And in reality, it creates dysfunction. It creates too much of an extension here, which then takes away the balance between the front and the back and the two sides. You're creating dysfunction, and that's by choice. A lot of times that's not necessarily by choice. If you're sitting on your chair with multiple monitors and instead of moving your whole body to look at each monitor, you twist, you spread your legs, and you're basically jamming one hip versus the other because you're sitting, your job requires you to, let's say, I don't know, let's say you're a massage therapist, or you're sitting at a table and you're doing stuff over the table and you spread your legs and you're rotating. Over time, that has its own toll. So what causes this functional movement disorder is the many things you do throughout your life. So is the answer stop doing the things? No, start being more aware of what it is you're doing. Educate yourself. This is the body that you were given at birth. You need to understand what it likes and dislikes. I bet you anything, most people know more about the cell phone, which more than likely you're watching this video on, than your own body. You invested in your cell phone to understand how it works. Invest that time on the body that enjoys the cell phone you just educated yourself on. So that's the cause. The solution is your desire and your wish to spend more time understanding your own body and its functionality. Pretty smart ass comment I just made, but I hope that woke you up. At any rate, if you have any questions, comments, or suggestions for videos, please forward them to me using one of the methods of contact in the description box. And until next time, take care.